Good morning to all of you. On behalf of the Department of Psychiatry, SDM Medical College, I extend warm greetings to all of you and wish you and your family a good health. 10th of October is observed as World Mental Health Day since 1992. Every year, a theme-based discussion and awareness programs are held, and October month happens to be Mental Health Awareness Month. This year, for the year 2020, the theme for World Mental Health Day is Greater Investment, Greater Access, Everyone, Everywhere. We all can agree that this pandemic has spared none, from the most poor to the most richest too. And in this turmoil, we see it's not just affecting the physical domain, but also the psychological domain at large. As I just said, World Mental Health Day is observed since 1992, and the present statistics about mental health state that there is a dire mental health need when there is a high toll on mental health outcome. 13% of global health burden as per WHO 2012, and every 40 seconds one die by suicide. That is 8 lakh per year, more than war or homicide. And it's the second leading cause of death in the age group 15 to 25 years old, and it accounts for 79% of deaths in this age group in the low and middle income countries. World Economic Forum in the year 2018 has stated that mental illnesses are rising in all countries, and by the year 2030 it will cost $16 trillion if neglected. It is stated that it will be a mental health catastrophe if unattended to. So what are the basic areas which we need to look into? The drive is for universal health care. The key target is for good health and well-being, and it has to be motivated by desire for health equity for all. And all should have access to quality mental health services where they live, when they need, without financial hardships. It is possible, I surely feel. We all need to know from where we can start it. We need to strong PHC, that is primary health centers, which need to propagate the idea of holistic and need-based decentralized approach. It could be on individual levels, family levels, or community level. For this, mental health needs to be prioritized, and most importantly, the government needs to invest more. Director General of World Health Organization, Dr. Tedros Ghebreyesus, has said that world is accepting universal health care. Mental health must be an integral part of universal health care. Nobody should be denied quality mental health services because they are poor or live in remote areas. Psychosocial support is the most important aspect in mental health national plans, and this needs to address the mental health challenges and impact of COVID-19 on populations. So the theme is relevant as also very significant for today's discussion. Mental health is a human right, and quality and accessible mental health to be made available to all. What is important to understand in our context, in our subculture of India, is that a lot of resilience has been demonstrated by our people. It is displayed by individuals and communities, wherein they relaunched, rediscovered, regenerated themselves as a response to this stressful time. World Mental Health Day is not a one-day event. It should start now and continue to ensure no one is left out. One needs to use this opportunity to focus and prioritize on mental health. Dr. Ingrid Daniels, President of World Mental Health, has stated that we can no longer ignore redressal or investment in mental health. Underinvestment in mental health has led to huge treatment gaps globally, 50% in high income countries and 85% in low and middle income countries have no access to treatment as per WHO report. So what is important? Coming back to the issue of theme, mental health is an investment and not an expense. One should prioritize to prevent a future catastrophe. During pandemic, further stretched to its limit. World Health Survey 2014 states that government spends only 3% of health budget on mental health, that is less than 1% in low and middle income countries and 5% in high income countries. Investment need to scale up mental health, and at this juncture one needs to invest about 147 billion US dollars, but one needs to understand but the returns would far outweigh the costs. WHO in 2019 has stated that every US dollar spent on scale up will give us $4 in return of improved health and productivity outcomes. These investments are not purely government or doctors' responsibility. Each individual are an untapped resource in mental health care. One needs to use World Mental Health Day to hold attention of governments, donors, policymakers, all stakeholders to ensure action for greater investment in mental health. Let us hold hands and unify voices in moving mental health investment agenda for increasing focus and access to mental health. Make mental health a reality for all, everyone, everywhere. Wish you all good health. Thank you once again. I would like to apprise our helpline availability 24/7, and I would like to bring to the notice of all concerned that this helpline and the team behind it, that is the Department of Psychiatry, has been doing a commendable job in addressing to all the psychological needs of not just patients but also caregivers and the medical professionals involved. Thank you once again. God bless you all.